Hello friends and dear viewers of the Steer YouTube channel. Myself Dr. Palaniraman, a practicing pediatrician from Tamil Nadu. Today's topic for discussion is an important clinical sign, heart murmur. How common heart murmur is heard in the general population? Literature says the prevalence of hearing a heart murmur is around 50 to 78% in a childhood period, whereas in adulthood it is around 25%. Even though the incidence of congenital heart disease is hardly 1%. What does it mean? It means most of the times what you hear, particularly in the pediatric population, is an innocent murmur or physiological murmur or a functional murmur. So whenever you come across a murmur, three important questions you should answer yourself. Number one, is it an innocent murmur? Is it a pathological murmur? Number three, whether this murmur has to be referred to a pediatric cardiologist or a cardiologist. Okay, coming to murmur. What is murmur? Murmur is an abnormal sound produced due to turbulence of blood flow. When it is heard inside the heart, it is known as heart murmur. If it is heard outside the heart, in the carotid vessels or any vessels, it is known as bruit. Where one should hear the murmur with a thing? Usually it is heard with a stethoscope by auscultation. We all know the common areas where you should auscultate for: aortic area, right second intercostal space; pulmonary area, left second intercostal space; tricuspid area, fourth left intercostal space, all in the parasternal region, and the mitral area, are also known as apical area, in the fifth intercostal space in the midclavicular line, as well as a second aortic area or a neo-aortic area or a Erb's point in the third intercostal space in the left side. Also, you should hear in the axilla, in the back, as well as carotids for the radiation of the murmur. Usually the murmurs, all the murmurs are best heard with the diaphragm, except for low-pitched murmurs like mitral stenosis murmur or carotid bruit with the bell of the stethoscope. Sometimes in individuals who are obese or who are having emphysema or a pleuropericardial effusion, the murmurs may not be heard clearly. This you should have in mind. And one important question, whether murmur is equal to heart disease. It is not so. Heart disease can present with a murmur or without a murmur. For example, in the newborn period, the first week of life, most of the critical congenital heart disease present without a murmur. This one should be aware of. Okay, going beyond further. Normally, the blood flows from the atria to the ventricles. It is a smooth affair, and the ventricle is going to start to contract. The AV valves close and produce the first heart sound or S1. At the end of the ventricular systole, the aortic and pulmonary valves will try to close and produce the second heart sound. Whatever heard in between the S1 S2 is known as a systolic murmur. When it is heard beyond the S2, it is a diastolic murmur. When it is heard in all the phases, both the systole and diastole, it is known as a continuous murmur. Normally, it is a smooth affair and no murmurs will be heard. When there is turbulence of blood flow, the murmurs will be heard. What are the common systolic murmurs you come across in practice? It can be, number one, starting from S1 and ending in S2, that is known as a holosystolic or a pansystolic murmur. Number two, ejection systolic or a mid-systolic murmur. And number three, late systolic murmur. When it comes to holosystolic murmur, usually what are the conditions we come across? Number one, ventricular septal defect in children. Number 2 and 3, that is a mitral regurgitation and tricuspid regurgitation. And all the three conditions will produce a holosystolic murmur. The ventricular septal defect, the murmur is a harsh murmur heard in the left third or fourth intercostal space, usually present with thrill. And smaller the defect, the louder the murmur and lengthier the murmur. If the larger the defect, it is softer the murmur as well as the shorten the murmur. Whereas in case of mitral regurgitation and tricuspid regurgitation, it is a high-pitched, blowing, pansystolic murmur. Mitral regurgitation best heard in the apex, radiates to the axilla. Whereas tricuspid regurgitation murmur heard best in the tricuspid area and usually it increases with inspiration. It is well known, all the right-sided murmurs increase with inspiration, left-sided murmurs increase with expiration. Next, coming to the mid-systolic or ejection systolic. The common conditions are number 1, aortic stenosis, number 2, pulmonary stenosis, number 3, HOCM. Usually, the aortic stenosis and pulmonary stenosis may be congenital or acquired. In aortic stenosis, the murmur is a harsh ejection systolic murmur, heard best in the right second intercostal space, radiating to the carotids, present with the thrill, it's a crescendo decrescendo murmur. Whereas a pulmonary stenosis murmur, heard best in the left second intercostal space, but not much radiation and usually increases with inspiration. Whereas HOCM murmur is best heard in the left lower sternal region, nearing the apex also sometimes. And one important feature of HOCM murmur is all the murmurs heard in the pericardium decreases with Valsalva maneuver, whereas the HOCM murmur increases with Valsalva maneuver. Another murmur which can increase with Valsalva maneuver is the late systolic murmur of mitral valve prolapse. The third is the late systolic murmur, which I have told occurs in the mitral valve prolapse. Usually is preceded by a click, and it is a short systolic and late systolic murmur. Now coming to the diastolic murmurs. Two important diastolic murmurs are, one is early diastolic, number 2 is mid diastolic. Early diastolic occurs in the aortic regurgitation and pulmonary regurgitation. In a case of aortic regurgitation, it is a high-pitched, soft, it is a decrescendo murmur, heard best in the second aortic area or the ERPS area. Whereas the pulmonary regurgitation murmur heard best in the left second intercostal space and increases during inspiration, also known as Graham-Still murmur. Coming to the mid-diastolic murmur of the mitral stenosis, we are all taught clearly in the undergraduate days, it is a low-pitched murmur, it's a localized murmur, heard best at the apex, best with the bell of the stethoscope in the left lateral position. You all know the clear-cut characteristics. Now coming to the continuous murmur. The common condition which we come across is patent ductus arteriosus. There is an abnormal communication between the aortic arch and the pulmonary trunk, and there is pressure difference in the systole and diastole. You hear a continuous machinery murmur in the left second intercostal space. The murmur is louder at the end of the systole, spilling over into the diastole also. It can radiate to the back as well. The other conditions producing continuous murmur are aortic stenosis with aortic regurgitation, pulmonary stenosis with pulmonary regurgitation. As well as in children, you can hear in coronary AV fistula in the left lower sternal border. So far, I have enumerated the common pathological, systolic, diastolic and continuous murmurs. You would have noted I have explained the character of the murmur each and every time. And it's a very important thing because you need to know the location of the murmur, the intensity of the murmur, the radiation of the murmur, the quality of the murmur, shape of the murmur, pitch of the murmur. All of these characters clearly say which valve is involved, where is the problem, and you can easily diagnose. Now coming to the innocent murmur. We already told innocent murmur are very common. What are the characteristics of innocent murmur? It is a soft, short, systolic murmur, localized murmur, no thrill, no radiation, and variation with the posture will be there. What are the common innocent murmurs you come across? Usually beyond infancy, from a childhood to adolescence to young adult, these innocent murmurs are common. Three innocent murmurs are: number one, Still's murmur; number two, pulmonary blood flow murmur; number three, venous hum. Still's murmur commonly heard during the age group of 2 to 6 years and disappear during the adolescence. Heard best in the left lower sternal region. It is a musical, vibratory murmur heard best in the supine position. When you make them to stand, it disappears. In the same way, pulmonary blood flow murmur occurs in the late childhood, adolescence, and young adults whenever there is hyperdynamic circulation like fever, anemia, thyrotoxicosis, or in pregnancy. This murmur is well heard in the pulmonary area. It is a soft murmur, grade 1 to 2 murmur, no radiation, no thrill, and best heard in the supine position. The third one is the venous hum. It is a continuous sound produced by the flow of from the head and neck vessels into the thorax, heard best in the subclavicular region, and you can make it to disappear by putting a pressure on the neck vessels. Also, when you lie down, it will disappear or it will reduce in intensity. It is heard best in the sitting posture. So, after knowing the innocent murmur, I hope you will be able to clearly differentiate a innocent versus pathological murmur, and when one should refer to a cardiologist. Whenever there is a family history of heart disease or a history of sudden death and abnormal cardiac symptoms in the form of effort intolerance, exertional dyspnea, exertional chest pain, exertional syncope or palpitation, and abnormal cardiac signs in the precardium, hyperdynamic precardium, and abnormal heart sounds, and abnormal murmur, as I already told, pathological murmur, systolic murmur, diastolic murmur with thrill, and all the characters, you should refer to a cardiologist. Friends, hope by this time you will be clear what we have talked so far. To recap, I have told about the prevalence of the murmur. What is a murmur? What are the characteristics of the murmur you should know of? What are the common pathological murmurs? What are the common innocent murmurs? How to differentiate the both, and when to refer to a cardiologist. Thank you, one and all. Thank you very much.